So we're going to break down the concept of healing versus feeling today. We all know that when we start to feel bad or there's a symptom, there's something wrong in terms of our health. The problem is that how we often go about treating that symptom that becomes problematic. In today's society, an American model of healthcare, if it ain't broke, don't fix it. Then when it feels lousy, that's when you go to doc. So we tend to believe that if we don't have a symptom or we don't feel bad, so to speak, we don't have a problem. And this is where many people run into lots of trouble in their health, because just because we feel good, does that mean that we're healthy? Well, there's a reason why they call heart disease the silent killer. It's because you don't feel it. The same is true of cancer. Cancer is not normally diagnosed in the early stages, but rather in the more advanced stages, because you don't feel your cells replicating normally or abnormally until there's a problem so big inside the body that it warrants other symptoms. And so basing your health just on how you feel can get you into a lot of trouble and even cost you your life. If we're basing our health just on how we feel, then we have a treatment methodology to take a medication so that we feel better, and that's what we base our health on. Take the medication, cover up the symptom, feel better, go on our way. However, you should know by now that just because you're covering up a symptom doesn't mean that you're actually fixing the problem. And so, as I tell all of our patients, just because you unplug the fire alarm doesn't mean that you've put out the fire. In fact, many of you probably know several people that are on medications, maybe feeling good, but that doesn't mean that they're healthy. And show me any person that has actually improved their health by taking more medications. Unfortunately and very sadly, it is not the case. The standard of care for all medical providers, whether DCs, DOs, MDs, should always be to help a patient return to their highest level of health. And if that is the case, that means they should be getting you off of medications, not putting you on more. But how do we do that? Well, first of all, we have to understand where health truly comes from. Health is created from the inside. You have innate intelligence beginning in your brain that communicates through the rest of your body through your nerve system. It's your innate intelligence that tells your heart to beat, your cells to breathe, your food to digest, your cells to replicate. And when we understand that the primary objective of your innate intelligence is to keep you alive and to help you to adapt to stresses, then we can understand that the best way to make sure that we're going to heal from any and all disease is to make sure that that innate intelligence is working at 100% or getting the messages through your nerve system to the best of its ability. So really, when you're taking a drug, it has nothing to do with the influence of the innate intelligence and its communication with the body. It's just blocking those symptoms. So when you're getting adjusted, what you have to understand is that we're not adjusting you so that you feel better, although I want you to feel good. That's the least of my concern and should be your concern. When you're getting adjusted, you're removing the interference from the nerve system so innate intelligence can flow from above down, inside out, and give you the best ability or opportunity to adapt to stress so that you can live in victory. That's what health is all about. And so many patients will ask me, well, what do I do when it comes to health care? What if I do get sick? Let's say I get a fever. Well, we have to go back again and think about what innate intelligence is doing and what is actually happening when you have a fever. A fever is the body's defense mechanism. The fever is what builds up troops to go out and fight against a foreign invader, whether it's bacteria or viral. So American model of healthcare would say, well, there's a fever that's abnormal, we need to get it back to normal and reduce it. Well, by reducing your fever, what have you just done? You have put a hole in your defense mechanism and kept your body from doing its own job, which is fighting off infection or foreign invaders. So remember where health comes from. It's not from the outside in, it comes from the inside out. So when you do get a cold or a sickness, you have to ask yourself, okay, how do I help the body to do its job, to overcome? How do I support it in that? And so it may be getting proper amounts of rest, drinking lots of water, staying away or avoiding sugars and dairy, those types of things, just to have less of a burden or taxing upon your system while it's trying to fight off the infection. Antibiotics, as you know, in the mainstream media, at least they're aware that those antibiotics have created things like superbugs and whatnot, and nosocomial infections, which are hospital-borne infections. Well, the reason for this is bacteria is always, we live with bacteria. You are full of bacteria now. We have a symbiotic relationship with bacteria. You need the bacteria to exist, to survive. But when you start bypassing the body's innate ability to overcome and rebalance that bacteria in the way that it needs to, that's when we start to form superbugs and things of that nature. You have to remember that innate intelligence always knows what it's doing. Let it do its job. When you take an antibiotic, number one, you're eliminating all the good bacteria in your intestinal flora. Number two, you're side passing the body's again line of defense, so that the next time that the cold or the flu comes around, guess what? You're not going to have the troops to help fight it off, so you're going to be more prone to getting sick or infection. And it's a vicious cycle. So if you have a cold, man, it's terrible to go through, especially if you have the flu. Nobody wants to go through those things, but realize that you're going to be better for it on the other end once your body heals and overcomes. If you're concerned about it, there are questions you got to ask. Is a drug going to help or hinder? Is your condition life-threatening? If so, is it immediate danger or is it more long-term? Is it something that you've contributed to, meaning maybe poor diet or lack of exercise or both or a combination of things? Or is it something that was beyond your control? And so these are the things that you can ask, because we know that medication can save you in a crisis, in an emergency, when your life depends on it. But you have to understand is that health cannot, or drugs cannot create health. Okay, there's a big, big difference. So we can't rely on a drug to keep us healthy. We can only rely on innate intelligence, and supporting innate intelligence throughout our lifetime to help give it the best opportunity to keep you healthy. So when you're getting adjusted, don't get adjusted just for the feel of it. Get adjusted for the heal of it, and that gives you the best opportunity to live life in victory. If you have any questions, please let us know. We're always glad to help you on your journey towards better health.